Hi, I'm Dr. Simon Fung. This is an important message for our patients about the coronavirus outbreak in America. The second week of March 2020 saw America turn into a strange and unfamiliar country due to the coronavirus outbreak. It has become necessary to implement changes to protect public health, our patients, and our staff. This video is to explain why these steps have become necessary. Many people, myself included, initially thought of coronavirus as being not much nastier than the flu. It is much worse. To understand this, let's compare coronavirus with last season's influenza outbreak. Last season, about 40 million Americans caught the flu. This was despite 43% of Americans getting the flu vaccine. Coronavirus is more contagious than influenza, and nobody has been vaccinated. Left unchecked, it is not impossible that coronavirus can infect 80 million Americans or more. Besides being more contagious, coronavirus is also more deadly. Estimates for mortality rates from coronavirus usually range from 1% to 5%. If just 2% of the people catching coronavirus were to die, this would mean America would have more than 1.5 million people dying. Your chances of dying from coronavirus doesn't just depend on how dangerous the disease is. It also depends largely on how available medical care is, because survival in severe cases of coronavirus depends on whether we have hospital beds, whether we have adequate nurses and doctors, as well as our equipment and supplies, from protective equipment to ventilators and other specialized equipment. We have all heard that the majority of cases are mild. However, about 20% of patients can suffer severe or even critical disease. These people who have critical disease may not survive if there's not enough medical care for them. How many people will die from coronavirus depends to a large extent on how prepared the country is. How prepared is America? Well, we're not prepared well at all. Until the 10th of March, Americans were being reassured that everything was under control. Over the next 3 days, rapidly we saw the NBA suspended season, the NHL suspended season, and a national emergency being declared. What can we do? To minimize the impact of the coronavirus, we must slow down the spread of the disease. Now imagine if 80 million people were going to be infected eventually. It would be devastating if all of them would have come down sick at the same time. Under those circumstances, hospitals will be overwhelmed and mortality rates may exceed 5%. If the same number of people were to get sick over 4 months, it would greatly reduce the mortality rate and the system might be able to cope. Protect yourself with better personal hygiene. Wash your hands frequently. This is one of the most important steps you can take. Avoid touching your face, because most of the time the virus enters the body through infected hands touching the mouth or lips or eyes. Please note that wearing a mask will not protect you. Masks protect other people in the room if the person who is sick is wearing the mask. Practice social distancing. What this means is do not go to work if you are sick. Keep kids out of schools or playdates. Avoid socializing in person. Do not gather in large groups. And try to stay 3 to 6 feet away from others whenever possible. Thank you for listening and stay healthy.